Okay, we're going to go ahead and get started. Good morning, everybody. Glad you made it and through the cold and staying here and get warm. So, my name is Carrie Gilson, and I'm the manager of continuing education at the college. And I want to welcome you all this morning. We've got a great lineup here. We have Dan Kissinger. He came back again to talk to us. The first time was on just generalization of anxiety and depression, but this time he's going to actually give us some more interventions, which is what you guys asked for, so that's great. And Dan is he's the chair and associate professor of the Department of Counseling at the University of Nebraska at Omaha. So we are so glad that he is here again, and please make sure that you ask questions, and I'm sure he would let you ask questions afterwards as well. So welcome.
Thank you. Thank you. It's good to be back. I'm kind of a low talker, so just yell if you can't hear me. Please feel free to ask questions at any point. There's no need for me to just stand here and talk to you. I'm going to try to bring some, levity to 8 o'clock in the morning on a 10 below morning. So I appreciate you coming. I think a lot of I'm kind of excited, as kind of a geeky academic would be, to kind of talk about some of the interventions that we use and that you can use with patients, clients, family, friends, and yourself. There's a lot of good. I got lost coming here. I've been using a couple of these on myself today, and they, moderately successful, so they do work a little bit. So before we jump into interventions, I know you're all health professionals, so you don't just randomly start jumping into giving prescriptions and things like that. So just a little bit of a base before we get into the interventions. One, always have to be thinking about the Therapeutic Alliance, and the Therapeutic Working Alliance is a counseling-based or psychology-based view of the relationship. And the reason that it's so important is it really helps break down some of the elements of what might be going on interpersonally, relationally, and that can mean a lot in terms of why would you choose a particular intervention or how would you actually utilize that intervention. So always be thinking about the Therapeutic Alliance. And as I'm kind of known to do, I have way too much information on some of these slides, but my hope is that if you're super bored or it's just too cold to go outside, you could just kind of review some of this. But some of just the keys of this theory is that you can use it with any, and this is certainly some of this is geared towards counseling students, of course, right? But it's pan-theoretical, right? So you can use it with any theory that you're using, and that'll play out a little bit in the future. It's dynamic, as we know, relationships ebb and flow. So just paying attention to that ebb and flow. And then another really important piece is that conflict is inherent in any relationship. So, we don't shy away from conflict. It's actually, it can be healing. I mean, I'm not a doctor or a nurse or anything, but if you break a bone, my understanding is it can heal back stronger. So that's the same concept with the Working Alliance. Now, to really understand, to break it down, people think, well, what's the relationship? Just people getting along. But you can really operationalize this a little bit better. That can really help you in terms of choosing an intervention. One, might make a lot of sense. You want to have agreement on the tasks that you're working towards and agreement on the goals. And then the bond element of this is really where people, when they think about the relationship, they think about that kind of emotional bond. But I'd like to kind of point out, within the bond, here we go, you've got the mutual caring, the mutual liking, and then you've got the trust. And what I like to talk about with this is I have my own view on, when I work with clients or students initially early on, I say, okay, well, how did your session go? And they just inevitably say, and I know I did this too, I had really good rapport. The rapport was great with that person. And so my next question is, okay, that's great. Did you have any trust? Was there any trust in that? And they'll say, and it's kind of blow their mind, right? Because they equate trust with rapport, which it's argued in the literature that those are the same things. My position is they're not. I have rapport with a lot of people. Do I have trust with those people? No. So really kind of considering the real trust. You can really like somebody and care about them, but there may not be the trust. Now, why does that matter here? Because if you're using a certain intervention, if you mistake mutual liking and caring for trust, you can choose an intervention that may not be the most effective. or you can kind of use that intervention. You know, there's maybe gradations of that intervention, and you might choose like, well, we're getting along really well, so I can use this intervention at kind of this degree, which is not always the case. So it's always important to consider that. The next kind of pillar and the last one before we jump into interventions is the trans-theoretical model. Has anybody ever heard of this model? The stage of change model? Probably. Not an unusual model, not an intellectually challenging model per se, but absolutely really important to what we're doing in terms of choosing an intervention and applying that intervention. And of course, this is just really talking about the person's intention to change, right? The behavioral change element of things. And and you're listening for, a lot of times there's the content, but there's the meta communication going on too. And so you're listening for all of those different elements in terms of choosing an intervention. Your eyes are not blurry. If that looks a little, no, it looks better up there. But this is the stage. You've heard of these stages, but I'd really like you, as I kind of throw a bunch of words at you, to kind of consider all of the interventions that we're going to go over from the idea of, how is the alliance, how might the alliance be, how might that impact that intervention, or which one I choose, or how and when to apply it, and also the stage of change. It's a very easy concept to say, if you choose an intervention that is kind of set for the preparation or the action phase, but the person is in pre-contemplation, it's one of my favorite moments for an early counselor, because then their first comment generally is, and again, I'm guilty of this, is, well, the client's really resistant. They're just not ready to work. What's wrong with them? And I say, okay, well, let's take a look at a couple other things. So it really makes a big difference. And this is just an obnoxious amount of words on a slide, but if we'll just kind of take a quick second and look at pre-contemplation, whereas they're just not ready for change, right? And it could be that they're actually, I used to think, oh, they're just completely unaware. I don't believe that anymore. They could have really tried and just failed, right? They just couldn't overcome whatever barrier that was, and they kept sliding back. A lot of this is in the addictions literature. So, people backslide, to use my old Southern term. And that can be very just kind of debilitating and discouraging for somebody. So I've come to view that a little differently. Even though they're in that space, you can still use interventions, right? The simple act of building an alliance, which we all know is not that simple sometimes, right? So there's a lot of tasks that you can do. For today's talk, we're really going to focus a little bit on the preparation and the action phases, because that's really where you're going to start, planning, putting a treatment plan together, trying to figure out some goals and tasks and things like that. That they really kind of tend to be in those two stages. Okay. Really, in the preparation stage, particularly, is when you might find yourself starting to integrate a particular intervention. That's where that might kind of manifest a little bit easier. Okay. So my last talk here, this is just I guess I just made my presentation longer by throwing in a couple old slides from the other one. I'm not going to spend a lot of time on these kind of broader evidence-based kind of paradigms, but as you can see, there's a lot of them. And what I'm going to do is kind of get a little bit into the weeds with some of these and show you particular strategies within these, and hopefully you can take some of these with you. I am not pro or con psychopharmacology. I tend to be, well, that's not true. I tend to be pro if it fits within, the proper treatment. I'm a therapist by training, so I'm not trying to get people on medication right away. I believe in combination, though, they can be very powerful. So that said, there's just a lot of different elements that you can utilize. Okay, this is for the bipolar disorders, of course. Maybe because there's a ton of stuff within this. But if you maybe just think about relapse prevention, working with folks that have bipolar disorder, a lot of it is just working with them, strategies to help them process, I do have bipolar disorder, and that's what this means for me, and going through their life and using different techniques to help them, notice their different thoughts about different things. It's really, there's a number of things that you're going to see pretty quickly how within that relapse prevention paradigm, a lot of the interventions that we're going to talk about today fit in there really well. Again, panic disorder interventions. Again, you'll see, feel free to, study up on that a little bit later. You see some of the consistencies in there. So I'm almost there to an actual intervention, I promise. So now the theoretical underpinnings a little bit. I'm not going to spend a ton of time on that, but I want you to know, how you kind of conceptualize things. If you are somebody that believes what I'm saying to myself impacts how I'm feeling and ultimately how I behave, or if you're interested in more the here and now versus history, that can of course impact not only how you're hearing a client's story, but how you might choose that intervention and how you might ask the client to implement that intervention. So there's a little bit of that. This is the exact statement, as fancy as it is, about what I ask my students all the time, and I ask my supervisees, and I get asked by my supervisors when I sit with them. And it's a very simple question, but it is not an easy one to answer sometimes. I am not the only person in this room, I bet, that has chosen an intervention that you wish maybe I should have held off on that a little bit, or I should have maybe tried something a little different prior to that. So this is just a way of kind of keeping us honest, but it also has a big conceptualization piece to it. So bias noted, I love Adlerian theory, so I tend to use a lot of these. The reason is, from my own bias standpoint, is Adlerian theory, individual psychology, tends to have the point, it emphasizes this: I am influenced by my history, but I am not determined by it. So I tend to, and if you kind of hold on to that notion for just a second, you don't actually have to believe it, but if you believe that you are influenced but not determined by your history, you can imagine the intervention that you use might try to get at earlier kinds of thoughts or earlier kinds of perceptions. So what Adler was saying was, early on, we all have experiences and we all make interpretations of those experiences. And within that early interpretation, there's what he termed a basic mistake. Okay? Now, a basic mistake, if that is held, you kind of go through, and you don't do anything about it, you don't recognize it, et cetera, you go through other experiences and you filter other experiences through that basic mistake. One of the big ones is, I'm not good enough, right? So if you make a basic mistake early on that I'm not good enough for some reason, and you go through the rest of your experiences, you can see how that filters through, and it can be very discouraging, okay? So I highlighted encouragement because that's a foundational piece. That's an intervention. Just being encouraging is an intervention in and of itself. So there's a number, I love these interventions, okay? Again, my bias. So one is the empty chair, and that's in some other different, you can utilize this within other theories, right? Empty chair, my first thought on empty chair is make sure that you tell people about what this is, because here's how it sounds. I'd like you to sit in a chair and pull another chair, and I'd like you to talk to that chair even though nobody's there. I mean, that's really what it is. Now, it sounds a little nutty, right? But it can be an extremely powerful intervention. I want you to picture that person that you're upset with in that chair and tell that person what you'd like to tell them. No holds barred. If you have to swear, curse, cry, whatever you have to do, let them know. Here in the safety of my office, or something like that. I've had clients that have brought in pictures that were struggling with their self-image. And they would bring in pictures of when they felt good about themselves, and they would talk to that person. Just kind of talking it out. Now, with any intervention, some of these go real well with just a layperson, a medical professional, that you're not a licensed therapist or anything like that. So some of these, though, I caution, be very careful about using these, because, of course, if you utilize an empty chair and that person is triggered by it, now you've got to be capable of handling whatever is triggered, right? So two sides of that coin. The acting as if, and is this connected to the internet at all? Well, no, this isn't the right one. Never mind. Making her work hard. Sorry about that. If any Seinfeld fans Well, acting as if, this is not a one-to-one, but if you remember George Costanza, where he just decided to do the opposite. Remember that? He goes up to the woman in the restaurant, I'm George, I live with my parents, I'm unemployed, all this kind of stuff. And he just starts applying that to his life. He thinks, if I just do the opposite, everything will be... Now, that's an extreme example, of course. But this is a really good activity and strategy for people that are really struggling with something. You know, I want you to go and act as if that's okay. You know, act as if you're capable of handling being upset. Right? Just that basic acting as if you can do it has a very powerful notion. Not sophisticated in any sense, but acting as if you can just give it a try. It just kind of gives you a little bit of license to just go try it and not worry about it. Catching oneself. Another simple, you know, hand in the cookie jar. Oh, I caught myself, right? So from a learning perspective, you'd have to what's that basic mistake, right? So there'd be some insight into what that basic mistake is or something you want to change. Okay, boom, I'm just going to catch myself doing it. That's it. Caught myself. Not going to do that. I'm going to move on, some other diversionary. So again, these are not sophisticated things, right? But they can be very powerful. The push button technique, this is one where I do give some caution. So what you're asking people to do, and if I had more time, I just, because it can be very powerful just in the sense of helping people understand that you can control your emotions, that you really can. And what you do is, I would ask people to relax, close their eyes, and then think of an unpleasant situation. Now, this is where you have to be really cautious, not traumatic, something like just a situation that's not particularly pleasant. You went to a restaurant you didn't like, the food was bad, something like that, right, initially. And have that person kind of in their mind's eye just think through that. What was going on? Who do you see? What was around you? You know, what was the social milieu of what was going on? What did you feel? All those kinds of things, right? So you hit the thinking, the feeling, and the behavior, all those kind of things. Then give that person a little while. Then say, I'd like you to transition into a more pleasant scenario and take them through the same thing. Describe what you're seeing, describe what you're feeling, what's going on around you, and then stay with that for a minute. Then I want you to go back to the unpleasant situation for just a minute. Now, if you're ever really bored, try that and give it a good try, because it can be very, very effective. And even, so say somebody's really struggling with being able to, you know, have a sense that they can control anything, or they have any idea of how to get better. If they can go back and forth and feel any difference, that's at least an entry point into helping that person realize that they do in fact have some control over their emotions, right? That they can think their way through it. So it can be a very helpful, and you think about where that person is on the stage of change, right? How would you utilize that for somebody that's at a preparation stage? You might just be talking about that. In the action phase, you might have them utilizing that once a day or twice a day, or whenever that basic mistake comes up and they feel anxious or they start to get down. So that's how you kind of, you know, intentionally use that. And then think about, you know, the acting as if, or the catching oneself. You know, you can utilize those differently depending on the strength of the alliance, right? If you have kind of you just met the person, you don't have a real strong level of trust. There's still some, you know, question of, you know, do I actually like this person? Does that person like me? So you're not really there yet. So you might use that in a very kind of minor way. Just kind of introduce it. Have them do one really, just try it once, something like that. And as the alliance builds and there's more trust, you can see how already you can utilize these techniques in different ways, right? Depending on what's going on. The aha experience, and that's kind of the eureka moment. That's a very Adlerian notion of insight followed by action. Just having an insight's not enough. There's got to be some action that follows it. So if you have an aha moment, then maybe pair the aha moment with the acting as if, or the push, or the catching oneself. So these don't have to be individual. You can bridge them, you know, based on what's going on. Anybody have any questions on those? Okay. Simple but effective, right? But always think about the alliance and then where they are in the stage of change of how you might actually, how, when, and why you might actually integrate that. REBT. REBT is the rational emotive therapy and some of these interventions. They're all cognitive. So the Adlerian, the REBT, and then the CBT that we'll talk about are all within the cognitive paradigm. So there'll be a lot of paying attention to what's going on in your head, using interventions that kind of directly address that. So the goal here is, basically REBT says we stand in our own way, right? All theories kind of say that, but this one kind of says you're just blocking yourself. And has anybody ever said, I must do something? Or I ought to be doing that, or I shoulda, coulda, wouldas, that kind of stuff? That's very REBT, right? And so that perfectionistic, it's always got to be right, I should have done better, all this kind of stuff. So what REBT is trying to work on is just starting to put up barriers to that, to take a more reasonable, they say rational approach to it. I've learned to not use rational with clients, because what's the first thing that they say? What are you saying? I'm crazy? So I personally don't like that word. I just use reasonable or something like that with people. Okay, so you're just looking for some of these emotional dimensions, like the role play. Now again, role play, it can be extremely effective, but constructing a role play can be fairly complicated. You've got a lot of things to consider in that role play. And for the sake of argument, how's the alliance? How strong is the alliance? If you have a weaker alliance, you haven't been around that person yet, the trust isn't there, you might have a role play that's very introductory in nature, right? You're not really you might not use a lot of intervention, it just might be playing just a basic idea of what goes on in that person's life. If you have a really strong alliance, you can kind of use those, and you can push buttons a little bit, you can challenge them a little bit more, or maybe you can use a few more interventions that somebody that doesn't have as much trust with you might not be willing to kind of take in. So there's that. Disputing, a lot of disputing. I have a particular friend that just, when she sees me coming and she's having one of her I have to be perfect days, I can just see her cringe from like 50 feet away, because she knows I just get sick of it and I'm going to just call her on it. Now that's with a friend, but I'm just disputing it, right? I'm just saying, so you're going to be, you didn't get 100, or you didn't give a perfect lecture or something like that. So you can utilize that in a lot of different ways. I have a really good both rapport and trust with that person, so I can just directly, and so I can use, and I don't suggest this, but I can use really kind of pointed sarcasm and things like that, but I'm disputing it. Now are you going to do that with a client? Probably not, right? But there are degrees of how you might dispute things based on where they are, based on your relationship with them. The behavioral dimension, one of my favorites to talk about, they talk a lot about shame attacking exercises. And you've probably heard about those. They can be very effective, but they can sound a little odd, a little eccentric. One of them, I don't know if you've heard of this one, is, well, in this case it was a banana. My friend had to put a plastic banana on a string and walk through the mall with that banana. And when she first told me about that, we were both in our master's, our counseling programs, and I remember thinking, and we hadn't apparently got to the intervention lesson yet. So all I heard was, he made you drag a banana through the mall? Like, that's all it sounded like to me. I just didn't have any context for that. But that shame attacking exercise, what was going on? She had a lot of anxiety about people watching her. She was the center of attention all the time, just that social anxiety. So that was just shame attacking. And she did it a couple times. She said the first time she did, she just broke out in a sweat and felt kind of crazy. But then she kind of started to work through it. This really isn't a big deal. What's the worst that can happen to me? Somebody makes fun of me for dragging a plastic banana through it. I would make fun of me for dragging a plastic banana too, right? But it really helped her kind of start to see that it's not that bad, right? And there's no need to have shame for certain things. Now, again, there's a dimensional approach to this like everything else. So you can imagine a risk-taking behavior. Somebody that has, maybe went through a divorce and very wounded, and just slowly starting to think about, maybe I'd like to go on a date, or just like to meet somebody. Something like that. So, the shame attacking is not say, well, okay, this is great. You're thinking about this again. go and ask the next person that you meet out. Right? I mean, I cringe even kind of thinking about somebody giving that advice. But you might try in the office, I'd like to role play with you what it might be just starting up a conversation with somebody. And then you can do that and then say, okay, let's role play that you've worked with this person for a while and you're going to ask him or her out. And let's talk about what would happen if that doesn't go well. So you can build on that, just like everything else. It seems obvious in many ways when we hear, like when I would hear professors talk about things like this, it always seemed very obvious. Well, of course, I would just choose that intervention at that level, and I would have somehow randomly considered the stages of change and the alliance and other contextual variables, my own variables, as a clinician. But it's easy when you're working with clients, and I'm sure you know when you're working with patients, why do we get up and go to work in our various professions? Because we're helpers. We want to help people. We want people to do better. That's what motivates us, or we'd all, that's why we make the big bucks and just take beach vacations all the time, right? When it's 45 below, because that's what keeps us going. Okay, so those are three. So this is the third cognitive area, and this is one from an evidence-based perspective. You probably heard about this, right? Everybody talks about CBT. A lot of good interventions here, and I'm going to try and break it down a little bit. This is for your, if I was going to have a quiz, this is what you'd have. Give me the 5 CBT things, but we're not going to worry about that. Well, I'm just going to give you the basic because you probably have heard of this. CBT essentially says what goes through my mind impacts how I feel and how I ultimately behave. Now, when I talk about, where do you kind of enter this? Because everybody's like, I have to first of all figure out what's going on in the person's head before we can talk about how they're feeling and behaving. I would suggest to you that if you have a client that's very emotive, is very much in the emotional domain of a patient there, you might say, tell me what you're feeling. How are you experiencing this particular event or situation right now, or that person, or being in the room with that person? So you can go in, so to speak, at the emotional dimension. But ultimately, what CBT is saying is I need to understand what's going on cognitively. So you can say, when you're experiencing that emotion, what thoughts go through your head? So that's how you kind of get and access the thoughts. Now, think about, just as an example, think about somebody that you've had just a little bit of conflict with. Don't go down any rabbit hole or anything, but just think about somebody that you've had, or something that you've had a negative, kind of struggling with. Okay, so just figure out what that, identify that event or person or whatever it is. Now, I'd like you to just take a second and just check in your head, what was the thought or thoughts that immediately went through your head? Now, that probably wasn't too hard, right? Because we just have quick automatic thoughts that come to us very quickly about certain events and people and blah, blah, blah. But what we're listening for, if in my seat as a therapist, right, say, tell me what's going on. And I'm listening not just for the content, but I'm listening for just any repetitive, what's the record, what's the thought? And I'm also listening within the context of that thought for what, back in the CBT folks call a distorted thought. So take it back just for a second. Adlerians tend to call it basic mistake. You made a basic mistake in your kind of conceptualization and in your thoughts. REBT talks about kind of, irrational or unreasonable, and then CBT talks about distorted thinking, right? Distorted thoughts. So these are just, various cognitive versions of there's something kind of not right with the cognitions of what's going on. You're trying to identify pieces of that. So you might listen for, just for yourself, any hot cognitions, right? Is there any particular word or phrase or something that comes to you pretty quickly when you think of that person or event? Right? So that's one of the things that you'd be paying attention to. Then So that's kind of here. I'm old enough to remember the old, life is not a bowl of cherries, or life, or whatever it was. Because a lot of times that's what people think CBT is. If you just think positively, everything's going to be better. Well, I don't have to tell a group of nursing professionals and health professionals that's bunk, right? It works momentarily. Nobody's denying that. But second order, qualitative lasting change from a CBT standpoint requires understanding what these assumptions are, what these core schemas are. What core schema triggers that consistent negative or distorted thought? So in order to really make a change, yes, you can identify the negative thought. It's kind of an entry point oftentimes, because people are really thinking about the core schema. But that's where you really want to get to. So some of the interventions that we're talking about you can utilize, you can kind of focus in at the automatic thought level right away, what goes through your mind. It can be very effective. And then say you build more trust with that person, then you might use some of these techniques to get underneath that automatic thought, more towards the assumption that's part of that core schema. And then you kind of attack that, that's too strong a word, but you go after that assumption, right? And find out where that's distorted, and then use interventions like cognitive restructuring and things like that to restructure that core schema where that distorted thought is kind of coming from. Again, it's the process of that is not, just structurally that makes sense to everybody, I know, but you can imagine how challenging that can be for not just being able to link the automatic thoughts with, like if somebody just, oh, I'm really mad today, and all this kind of stuff, to link that with a core schema of I'm not good enough, that might not seem obvious, right? But it might very much be there, but it's just the automatic thoughts have so kind of distorted things. That's all that person thinks about. The underlying issues really haven't been dealt with. So one of the techniques is decatastrophizing. That's just that what if, right? Oh my God, the world's coming to an end. This I'm going to fail this, et cetera, et cetera. We've probably all been there to some degree. You've worked with people that have been there. You have family members, friends, yourself, whatever. So just challenge that. What if that wasn't the case? What if this was a possibility, right? And again, not the rainbows and unicorns kind of response to that, because that doesn't really work. That just makes people mad, right? You're like, oh, I like to do that with my family because it really works them up. Oh, don't therapize me. Don't do that kind of stuff. But it gets a reaction, right? So granted, that's partly why I do it. But it also can be very effective in just showing how it can get a response. It can flip the switch a little bit if people are really focused on that. Redefining, the example there is kind of one I just randomly, nobody called me for 2 weeks, I didn't even get a text. Well, if that automatic thought just keeps going, right, negative thoughts around that, that's not the core schema. That's that automatic thought. Nobody ever calls me, nobody ever writes me any of this. What's that connected to? What's that underlying assumption? It might be much harder to get to that underlying assumption than it is, initially at least, to get to that automatic thought. And then you can just help refine that, right? Oh, maybe, how about if you reframe that as, I need to let people know I'd like to go out, or something like that. Again, not super fancy, but it flips the script, right? And then decentering. This is one with people with anxiety. It works really well a lot. People that have social anxiety or things like that often tend to always just feel like everybody's watching them. They're always the center of attention. They don't want to be the center of attention, but it's always. So you can help decenter them, right? Which is just say, we're walking in the mall, so to speak, and that person, everybody's watching me. So you might just question that, really? Do you think that person on the phone is watching you? Or, just little things like that to help kind of draw them out from that, everybody's watching me. A bunch of behavioral techniques, the CBT. So we talked about the cognitive stuff. You can go in at the emotional level. With the behavioral, social skills training, helping people understand, quite frankly, the difference between assertive communication, aggressive communication, passive aggressive, all that kind of stuff. Just little things like that, because then they start to hear language differently. They start to use language differently, and all these kind of things. There's also the relaxation. You might expect a therapist to want to have everybody relax and do progressive relaxation. It doesn't work for everybody, but it works very well for some people. So that's one. Activity scheduling is great. Instead of, if your mind starts to race, get out your calendar and plan so that you know what's going on. And there's exposure therapy. So these are probably not new to you, having heard these. But now think about how might you integrate an Adlerian technique, say acting as if, with a social skills training. So for example, let's take the notion that you have pretty good trust with this person, and they're in a preparation or an action phase. So that's kind of our context for trying this. You might say, we're gonna work on. We can even bring in RABT. We're gonna role play. So we're gonna role play a situation where you are this person you're having conflict with, or I'm the person you're having conflict with, and you are going to utilize your new skills of speaking assertively. So you're going to act as if you can speak assertively about this situation to that person. So right there, you're combining 3 different kind of orientations, 3 different interventions in one. But again, you've considered how strong is the alliance, and where is this person? If you're going to try that with a person in a pre-contemplation stage or even contemplation stage, you can imagine you might not get the same response. Okay, so here's a lot of good ones. The grounding technique, again, probably not new to you, but extremely effective. I did this one time, not by choice, but just by kind of crisis phone call. I was walking to class, and my client in my private practice called me and said, "I'm suicidal. I'm on the road," and she was on a very busy road. And of course, I thought, well, okay, I'm going to be late for class. Was my first kind of thought, right? It's my hot cognition, I guess. And I thought, okay, what? And don't get me wrong, I took it obviously 100% serious. So I said, okay, what quickly can I think of here? And we had done a grounding technique before because the emotional regulation was an issue obviously with this person. And so in the car, I said, okay, just focus on the road, but dig your feet into the ground, get your feet on, that kind of stuff. And then I would say, okay, tell me 2 things you can see. So I kind of talked her through that, and she pulled over to the side of the road. We did it in kind of more detail, and she calmed down, was able to get home, and it worked, thankfully, very well. But this is something that doesn't have to be a crisis-oriented thing. It can center people. You can use it when people when their minds are racing, right? So that if it's an anxiety-based kind of intervention that you want to try, okay, let's bring you in the here and now. You're anxious about going to that speech or something like that. So let's do a grounding technique and just get you centered. And so the grounding technique, of course, is just saying, tell me, and you might start with one thing, right? Tell me one thing that you can hear. Tell me one thing that you can see. Tell me one thing that you can touch. Boundaries are an issue there sometimes, right? I say that because I worked with a juvenile offender group, and they had a lot of poor boundaries sexually and behavior and things like that. So know your audience, obviously, on that. But take a person through all their senses, and then maybe another one, and then another one. And just slowly get them centered so that then you can do the work, or at least the crisis has been averted, or they're kind of ready to do something else. And you can imagine that you can do that if somebody's struggling with depression, anxiety, relationship, anything, right? It's a really good technique. And teaching it to people is one of the best things I ever learned to do as a clinician. The thought stopping is a very common, a very helpful cognitive technique. Thought stopping is simply your mind, right? The automatic thoughts are going pretty strong. If the person is aware of the assumptions, that's good too. You're aware of that. But say you're having that thought of, I'm going to fail this test, and it just can't stop it. So you're going to have some tool. It can be whatever works for you. Some clients will say, I hold up a stop sign, or I hold up a yield sign, or I blow a whistle. I had one client that would close her eyes, and she would write everything on a chalkboard in her mind's eye with this really big piece of chalk, and she'd step back real quick and then erase it. That was her version of it. So there's all, it might sound, the first time I heard that, I said, wow, that's kind of unique. I never heard of that. But whatever it is, the goal is I recognize that that's my mind's racing. I'm going to use my barrier, whatever that is, and then once I'm able to stop that or slow it down, then I go to not your happy place per se, but a place of relaxation. Right? You got to have a place to go after that. So you just stop it, and then what happens, right? So you stop it, and then you maybe do a grounding technique to get you, or something like that. Okay. Cognitive restructuring. This is well known within CBT. This is what I talked about before of kind of, reframing, not reframing, restructuring that thought process. And that is a multi-step process. So that doesn't say, oh, we're going to think differently and then everything's going to be okay. It takes time, it takes practice. Think of all the interventions that we've talked about today that might be a part of restructuring that. Okay. Homework, very common. You can do all kinds of homework. One of the really positive and easy to do is just to have a chart. So you can have, and I meant to bring one, I apologize, but they're easy to find. Google cognitive behavioral worksheets, right? And there'll be a column for triggering, like what was a triggering event, or the situation, whatever. What was the thought? What was the automatic thought? What was the emotion? What was the behavior? And what was the outcome? So you can simply just have people keep that record for a week, or do it yourself. That's a good way to start, and then say, bring that back, or review it, and then bring it back and let's talk about it. So that's a really good way to start getting a sense of what that person's particular themes are, right? And the really positive thing about it is people start making connections with that worksheet that they maybe have not made before. And that's a good way to enter into starting to talk about actually restructuring that. There's a bunch more. Behavioral reversal, role play, diversion. Diversions can be words, it can be actions, things like that. And then graded task assignments. That's another one of, be careful, right? You don't want to have them try something that's too hard and they fail, right? And they get more discouraged. So really important with the graded task assignments in particular to know where they are in the stage of change and to apply that to that. This was from my last, mindfulness. That's just that matter of going from doing to being. And boy, I wish it was that easy, right? Because that can be really hard for some people. But you're slowing things down, right? Ironically, mindfulness-based cognitive therapy, you would think there would be a lot of focus on thinking, but it's actually on slowing that down and just being, okay? And all right, you made it through just about. So the solution focused, now here's in comparison. So the Adlerian kind of says you're kind of impacted by early experiences, but you're not determined by them. So there's that historical piece a little bit. Solution focused interventions, as you might imagine, are very here and now, right? We're not going to worry about what happened, whatever that experience was. We're going to take a look at what are the solutions to that. And there's some really good interventions. And if you would, you don't have to close your eyes, but closing your eyes sometimes helps. I'd like to take you through the miracle question. So if you're willing, close your eyes. If not, just hang out. But I'm going to read this to you. And I want you to just kind of follow this as we go and see what comes up. So if a miracle happened and you awoke to your problem having been solved, what would be the first sign this miracle occurred? Once you have that, the next question is, what would you do differently? So that's just, that miracle question is really, really powerful. It just flips the script really quickly. And it just, a miracle. So you don't have to worry about anything else. It happened, right? So you can just focus on that, right? We have to suspend disbelief if we're having a bad day sometimes, but it's a really powerful intervention question. Then some of these reciprocal questions after that really help the person think through that, Who would notice? How would they respond? How would you respond? What else would be different? So instead of worrying about the issue, the focus is on finding a solution and what the difference is. It's a really powerful intervention. Solution focused, a lot of what you, another really good intervention is simply the idea of exceptions, right? That's kind of what it's built on. Solution is, there's an exception to it. And so just people say, oh, it's never, it happens all the time, right? They use those definitive phrases of it happens every time. Well, it couldn't have happened every time. So tell me about a time it didn't happen. Again, not a sophisticated response, right? But if you hear that from a depressed person, for example, or an anxious person, for example, they tend to have that, they're just on the rails with it, right? It's always the same thing, really hard for them to get off it. Beck talks about in depression the cognitive triad of that negative view of themselves, of life, of those kinds of things. And so when you hear people do that, you could throw that in there and say, you know, all these negative things about it. So it couldn't always have been like that. Give me an example of when somebody, you know, you got along with somebody. Or just these basic things, right? The exceptions. So instead of reacting to it and getting frustrated with it, which is easy to do with people that have depression and anxiety because it can wear people out around them, just start asking about exceptions and see where that gets you. Because they're there, but that's not where their focus is. So if they just start looking at the exceptions, then they can start applying that. Oh, yeah, I guess, yeah. So when that occurred, what was going on? What was there? It just opens that door to exploring when things didn't go badly or went better. The scaling questions, you've probably used this. This is not new, but you know, it's not just on a scale of 1 to 10, get that, but then the questions after it. How did you get there today? What led to that? And then that just finding a solution. The next piece is, if you were one number higher, what would that look like? Helping them explore. Again, not fancy, but can be very helpful in helping people just kind of get grounded on that and start looking for a solution. Again, the flag the minefield, that's also that exception, right? When do people get discouraged? Oh, when they run into barriers and things don't go very well. So challenge that. What might come up? You know, we're looking for solutions, so what kind of barrier might come up that you might have to deal with? And then how might you deal with that? What are some exceptions to when you got through that? So there's kind of that version. And then the unfinished business, right? Just ask them anything else. Fancy, huh? The last piece here is narrative therapy. And narrative therapy is what you might expect. It's narrating, it's restoring that person's life. Well, they do it, of course, but helping them. One of the, and I think the presentation after is about eating, healthy eating or not. So if somebody has, you know, an eating disorder, that's, you know, the more, you know, advanced version of that. But if people have problems eating and struggling with it, I've seen one of my supervisors taught me that whole notion of externalizing. And so, and this sounded really weird to me at the time, but she had a client that had an eating disorder, had bulimia. And I was really, because that's really a hard disorder. People really struggle with that. It's really hard to, it's very ingrained. And I was a really beginning counselor, and I was really just kind of on my heels about how to help and how to deal with that. And she started using narrative therapy a little bit with some other things. And she asked this client to externalize the bulimia. And I remember thinking, well, I don't even know what that means. How are you going to externalize something that's, right? And so she had this client name the bulimia. And I'll never forget what she named it. She named it Bob. Doesn't matter to me, but that's what she named it. And so for a while, early on, when that client was really struggling to just kind of make any sense of what was going on, she couldn't talk about bulimia, but she could talk about Bob. And so early on, that helped her just find an entry point into talking about the bulimia. So is it a perfect example? No, because it didn't end on let's just talking about Bob, right? I mean, it led to other things and helping her restory and things like that. But that's just kind of one version of what that might sound like. and I think you made it through. Does anybody have any questions? I threw a lot at you. You're welcome to this. You know, my email's on there. I'll send you any information I have. Don't be shy. No questions? All right. Well, thank you very much. I appreciate it.
Okay, we're going to go ahead and get started with our second speaker here. I want to introduce you to Lovely Taylor. She has her own practice. She's a licensed mental health provider, and her practice is called Living Our Vision Every Day. She's going to talk to us today about emotional eating, but I also want her to share kind of her history. She's doing quite a few things, actually. She has done and is doing, and so it'd be nice for you to get to know her a little bit better, and that might help with questions and maybe other topics that she can come and talk about later at another time. So welcome.
Well, thank you. Good morning, everybody. Can you hear me pretty good? Okay. If I get a little quiet, just throw something up here or just say, hey, I can't hear you. I'm really excited to be here. So thank you for the opportunity and thank you for showing up. Like she said, my name is Lovely and I have a private practice off of 96 and L called Living Our Vision Every Day. But I've also done a lot of work in the community with like Nebraska Children's Home Society as a therapist there, working with parents and doing a lot of the parenting classes and just one-on-one services directly. I've also worked with the foster care system, just kind of offering support to foster kids and foster families and kind of helping them navigate through the system. So that's been kind of one of my fun experiences. And also I'm a Circle of Security, Circle of Security parenting facilitator. Has anybody heard of that? I'm going to weave that in here because I think that that is really important. It's all about connections and building relationships with people and kind of understanding behavior. So it's a parenting class, but it's also a class that applies to just understanding behaviors. So that's me, and I'm really excited to be here, and thank you. So today we're going to talk a little bit about emotional eating. But first, let's check in with you guys. I'd like to know who I'm talking to, what's the attitude and the temperature of the room. So what's your weather today? You can just call it out. How are you guys feeling today? What's your weather? We have...
It's nice and warm and cozy in here.
Okay.
Partly cloudy.
Partly cloudy. Yeah, I'm a little partly cloudy. I had a little bit of sleep. We have any sunshiny days right now? No, the weather's a little too dreary for that.
I'm feeling a little anxious that I left one chaplain at the hospital. I didn't look ahead, but I had to see it.
Ah,
I'm a little guilty, but letting go of it.
you are forgiven and it's going to be okay. All right. So when you guys think of emotional eating, what images or thoughts come to your mind?
Eating out of a bucket of ice cream.
Yes. Yeah. What else? I like interaction, so please talk back. Hands in a chip bag, right? Do you have a visual? I always picture a plate of nachos in front of me, right? I didn't even realize that was my food until my husband and I were playing a game, like one of those newlywed games, and I said, what's your wife's favorite food? And he was like, nachos. And I was thinking, really? And then I thought about it. I eat a lot of nachos. I was like, that kind of goes with what we're talking about later. So sometimes people, when you hear of emotional eaters or emotional eating, sometimes we picture the food. Sometimes we have this visualization in our head. And we think of something like this, right? Is that accurate or inaccurate? What do you think? Could be either. Okay, I like that. But did any of these images come to your mind? The reality is, emotional eating can hit any of us. And there's not a pretty little picture that describes it or that says this is what that looks like when it walks in our doors, right? It can be a little kid, it can be a teenager, and it doesn't matter what size they are, it's what's underneath, right? So let's talk about some of the risks that make people prone to emotional eating. What are some of the things that you guys think about?
I think of sadness,
Okay,
Loneliness.
sadness, loneliness,
avoidance,
avoidance. Yes. So why am I here today? You guys got it. You're right. You're absolutely right. Some of the things that we're going to talk about 5 different areas that kind of make people a little bit higher at risk to tap into that emotional side of eating, okay? I gotta stand here. I got to remember that. Okay, so let's watch a little video and see if any of us can relate to this.
'Cause I'm looking in the fridge, trying to figure out why I'm looking in the fridge.
Does that look familiar? How many of us have done that? If we're being honest. I have. Has anybody been like, I want to go see what's in the refrigerator? The reality is a lot of us do that, right? It's funny to watch here, but one of the things that leads a lot of times to that emotional eating is just not even being aware of what we're eating, that we're eating, how we're eating, right? So sometimes in our busy everyday lifestyle, it's easy for us to just grab anything, right? We're busy, we're running from here to there, taking our kids here, running this errand, and now, oh my goodness, did I eat? Nope. Let me go grab something. I don't feel like cooking. It's been a long day. Let me just grab something to eat. And then we're grabbing for anything and everything that's accessible to us, right? Someone mentioned the bag of chips, right? Can I make a confession? My daughter and I said, okay. She said, Mommy, I want to make cupcakes. I want to make brownies. I said, okay. So we went home and we made brownies. A pan of brownies. And I was working on my presentation as well. So, somehow in the night, after she went to sleep, I looked at the pan of brownies. And then I looked at my husband and I said, I'm really talking about mindlessly eating, and I just ate. I'm not going to tell you how much I ate. This much of the brownies is gone. And I'm thinking about it, right? Because I'm actually talking about it. But sometimes it's just that easy to just be like, you know what, I'm hungry, and we'll just go get a little, just a little nibble or a little bag. And so this isn't about guilting, but just kind of creating more awareness of, let me focus on that a little bit, okay? Mindfulness, how many of you guys are familiar with mindfulness in general? Everybody. Okay, so we already know all the benefits, but I'm going to say them anyway. Some of them, and you guys can share some additional ones. We know that mindfulness is effective for stress relief, for learning self-control, for concentrating, to kind of regulate our emotions in general, to improve our memory, to get over that whole constant, rumination. And there's other health benefits. How many of us practice mindfulness? Show of hands. Those who do not, I would invite you to, even if it's just for a little bit. Mindfulness offers us a chance to slow down and just pay attention to what we're experiencing. So if we were to practice just a little bit of mindfulness here, we could do some breathing exercises, right? Let's do that real quick. Let's just do a couple, like the 4 or 5 deep breaths and just be in this moment. How does that feel for you? How does that feel for you? Did you feel a shift in your own self? Maybe you were a little bit anxious or a little bit just like, okay, had some feelings inside. And just for that moment, just stopping and taking a moment and saying, okay, let me be in this moment. Let me not worry about the next one or the one that just passed, but right here, right now. When we apply that to eating, it gets real creative. I like stories, so I'm going to tell you one. You guys okay with that? All right. If you're not, I'm sorry. So I just attended a mindfulness retreat. Did anyone else attend that? It was at Camp Joy Holling. Carol Joy Holling. Okay, it was a mindfulness retreat for mental health practitioners. I'm a talker. A lot of us are social workers or therapists, and we like to talk, right? We're social butterflies. So putting us in a space and saying, shh, is really hard. So they sent out this flyer, and they said, here's what to expect. We're going to do lots of mindfulness practice, and we ask that you not talk to each other. Don't talk about cases. Okay, I'm good with that. Don't talk to each other. Just be there. I was like, wow. I'm gonna be honest, I was a little bit nervous. Am I gonna be able to make it for 8 hours without saying anything to anybody? You know how hard that is? Would anybody else struggle with? Don't leave me up here by myself. That was hard. But you know what? We did a lot of meditation. We did a lot of just kind of analyzing stuff and just kind of being there. So for the most part, I tried. Here was the challenging part. They wanted us to sit together at tables and eat in silence. Does that work for anybody else? Would it be a struggle for anybody else? Some people are like, I love that idea. What was hard for me? But I tried it. I did it-ish. I did it most of the way. It was funny because some of us I hadn't seen for a long time. They ran over and they're like, okay. We were like, hey. And they were like, oh, you can't talk. They had this little saying or poem or prayer that they had at the table. And the format was that you walked up to the table and you stood there and you waited for it to fill up. So I think it was about 10 seats. So you had to wait for everyone to sit there, to arrive. You look at each other, you smile, and you say this blessing together. And you sit in silence, and you eat. But we did it. You know what happens? You're paying attention to what you're eating. You are not just eating and talking and socializing. You're paying attention to nourish your body. In the poem, it was talking about appreciating where all of these things came from, etc. So you're actually thinking about it. It brings you to the now. Now, if you're an emotional eater, practicing mindfulness might have some extra benefits. One, you're paying attention to the texture and the taste and the color and all of those things of your food. You're probably going to get a little tired of chewing because you're going to be paying attention to what it feels like in your mouth. You're going to be paying attention to all the flavors bursting, and you're probably not going to need to do that as long or for the same level of volume that you would if you were doing mindlessly. Something to think about. What do you guys think about that?
I know on so many, I hate to call them weight loss programs, but eating healthier, they always focus in on being mindful and eating slower, paying attention to what you eat, don't watch TV while you're eating.
Yeah.
All those things that are just being more mindful.
Yeah. It's said to decrease the amount and to help you kind of regulate your emotions as well. So that's kind of a double benefit if you can do it. To just being aware or just even saying, oh, wait, I have eaten half the pan of brownies. Stop. You're not enjoying them. But if I was taking a moment and enjoying the moistness and the color and the richness and then it's more of a delicacy. It's more of a nice experience. I'm there. I'm experiencing it. That's what it's all about. I'm actually paying attention to the experience that I'm having. On a side note, mindfulness in general, in practice, as I was reading, for practitioners who use it themselves, it's beneficial dually between the practitioner and the client. I thought that was kind of cool. So, something to think about. So one of the other things that came up as one of the reasons that people kind of are emotional eaters is food might be the only thing they use to reward themselves, right? You got a promotion at work. What are you going to do? We're going to go out and we're going to celebrate. You graduated from this. What are we going to do? We're going out and we're going to celebrate. You got a great grade. You get to pick your favorite restaurant. Does that sound familiar to us, right? So one of the things that as professionals we can do is to be aware of that and to kind of challenge that. What are some other things that you guys could offer people to find a variety of ways to reward yourself? How are some ways that you guys reward yourselves?
Maybe go bowling or something.
Yeah, go bowling, be active. I like a good massage. What are some other things? Get your nails done, get your feet done. You could even make yourself a healthy meal if you're being mindful. But that doesn't work for this example. But that would be, if you felt like you had to celebrate, but you were being conscious and aware of what you were eating and you were practicing, we might let that slide. But there's a lot of different things you could go dancing, just kind of helping people and ourselves think of a variety of ways that we can celebrate accomplishments. Another thing that makes people that may be a trigger to emotional eating is handling tough emotions. Life can be tough, right? You guys see there's all kinds of traumas that bring people in and out of the hospital, okay? It's full of emotions and opportunities to figure out how to respond to a variety of situations and moods, okay? If an individual has not identified healthy ways to identify and process their emotions, they may try to hide behind them or stuff them or eat them away, okay? Why would people do this? Why would people do this? They don't have other alternatives. I'm sorry. They may not be familiar with other alternatives. So I'm a therapist. And when I first started trying to figure out what my style was, I realized I liked whiteboards in my room, in my office. And so I would get whiteboards, and then I was like, people don't do feelings. So when you walked in my office, I would say, write down on a scale of 1 to 10 how you feel, and write down your emotions. And people would be like, I don't know how I feel. We'll figure it out, and then we'll start. You know, over time, it started really helping people get in touch with what they were feeling when they walked in the door, because we don't do that. A lot of times we're just going mindlessly, right? We're not tapping into how we feel physically. We're not tapping into what's going on inside. We may come to therapy, vent, say whatever we want to say, right? But sometimes it's important to just slow down and say, sweetie, what's going on really? How are you feeling really? Now, I mentioned to you guys earlier that I teach Circle of Security, okay? Circle of Security is a map, if you will, of how to meet people's needs around this circle. And it says, you know, go out and support people in their exploration and learn how to welcome them back in. Well, on the welcome them back in portion of the circle, there's a need called organize. Organize my feelings. Okay? I've taught this for 4 years, and you know the most pressing observation? People don't know what feelings are. Do you guys realize that? People don't know what feelings are. It's a foreign language to us, especially if you're my age or older. Because I know my generation, in my house, and a lot of the people that I work with, feelings did not have the level of importance in that generation that they do now. So to have someone actually identify, accept, and acknowledge their feelings is a struggle. But it's so important, because just because we ignore them or pretend like they don't exist doesn't mean they're not affecting us. It means we're going to hide them, or we're going to find some alternative way to cope or to deal with, right? So a healthy alternative to teaching, to helping people handle their tough emotions are A, teaching them what emotions are, helping them to connect to their emotions and be able to identify their own emotions and the emotions of other people that they interact with, and then learn a variety of coping skills that they can use to both handle their emotions and express them. And of course, having safe spaces to talk about them or to work through them. Okay? Any questions on that? That makes sense? So this is kind of An example of a chart I might have in my office. This is okay. What are you feeling? And then they'd have to go in and they pick. The one I couldn't find the one that's actually in my office, but it's like a million feelings, and it's so fun to watch people go from I'm mad to a few months later. I was feeling aggressive, but I decided that instead of just throwing a temper tantrum, I would go journal, or I would go, you know what I mean, to see that transition, to have them connect with themselves and their emotions and learn alternative ways to deal with that. Has been a really powerful journey for a lot of people. Negative body image is another thing that can contribute to emotional eating. A negative self-image can increase the pattern of emotional eating. Obviously, if you feel bad about yourself and then you see negative stereotypes, or you see negative images in the media, it's going to trigger a little bit more, and you might go out and grab that box of cookies to make you feel a little bit better, or the box of donuts or whatever. So if you already have a predisposition to feel badly, any other thing might take you back to the kitchen, back to the refrigerator, to kind of go soothe that and calm that down. So the counter to that is to build that self-esteem back up. Hey, let's deal with those feelings. Why are you feeling like this? Let's deal with those things, and let's get you either some motivation to maybe address the issues that underlie that body image, or maybe some motivations to help you change that behavior. Okay, but let's challenge some of the things that are going on underneath that body image. And how about this? I'm going to tell you guys another story. I was preparing for this, and I wanted to do like a fun little survey for you guys. So I decided to take one of my own. And I went online, and it was called TooMuchOnHerPlate.com. I invite you guys to go and do your own little survey if this is something, actually just for the fun of it. TooMuchOnHerPlate.com. They have this assessment, and it says, what are you hungry for? And it's not food. And I thought, all right, let me see what they're going to say. All right. So I did the little assessment, had no idea what they were going to come back with. And it goes, you are hungry for rest. I said, what? You know, they were right on the money. I had a little 3-year-old at home who doesn't like to sleep, and I'm always running around and trying to do this and trying to do that. And so the reality is, yes, I am hungry for rest. But what it linked it to is, okay, because you're tired, you're going to be more prone to grab what's convenient. To our point, when we're physically overwhelmed, whether that's under lots of stress, whether that's we're just too busy and we haven't eaten, whether we are just sleepy for one reason or another, our bodies are going to go, feed me. And we're not going to be looking for the mindless or the mindful alternative. We're going for whatever's there, right? So I'm not going to say meal prep, because we have to do whatever's realistic for us, right? And help our clients or our patients do whatever's realistic for them. But kind of have a plan. Okay, I know I'm going to be running around today, so maybe I should put an extra piece of fruit in my bag, right? Or maybe I should put some granola bars and some, whatever it is that is you're going to have access to, that you can kind of plan ahead and be in control of what it is that you're putting in your body. So when we're physically overwhelmed, those are also times that we can see a little struggle. Now, most of us already understand a lot of times, minus the physically overwhelmed, a lot of times trauma is the basis for a lot of the eating patterns that have been formed over life. These are the 5 main domains, but you can see trauma written through all of them, right? Can you see that? Do I need to? Can you guys kind of see trauma in all of these? If you've had a lot of trauma and you don't want to pay attention to what's going on right now, because maybe you need to disassociate, you need to be not here because it's painful to be right here. So you get used to doing whatever you may have to do to avoid and to not pay attention, and then that may leave you going down this pattern. Does that make sense? If you've taught yourself to satisfy yourself through whatever it is that you're experiencing traumatically by food, because that was what was accessible to you, you can see the link. It just kind of weaves in there. So I didn't do a major trauma, but when we're trauma focused, then we can see it. It's in there. I can't remember that commercial. Remember when we were little and there was a commercial, it was like, where's the beef? It's in there, right? You guys remember that commercial? Where's the beef? It's in there, right? It's in there. Trauma is kind of like that underlying foundation of a lot of this, okay? So if you are dealing with abuse, if you're dealing with mental and emotional stress and neglect, you're going to struggle with these same 5 domains, okay? So how do we offer support? We offer support by being empathetic. Understanding, yes, there's more than what you see. There's typically more than meets the eye. Not that you're going to get it in a day or two, but to just be aware that there's more to whatever you're looking at than what you see right there. And to be empathetic, put yourself in their shoes, be empathetic to whatever it is that they're experiencing. Maybe you have a maybe you have a patient who's really struggling and you're just like, why are they doing that? Everybody ever have that patient? Why do they do that? Y'all are too nice, right? You're right. You guys are amazing. But everybody has run into someone where they just cannot understand why they continuously behave the way they're behaving. And that's where I would challenge you to rise above that and say, there's got to be a reason. People don't just do things for no reason at all. So challenge yourself to be empathetic in spite of what you see, right? And try being non-judgmental. I know it's easier said than done, but it matters. If we're trying to lead people toward healing, or even to wanting to heal, they may get there faster if they're not feeling judged for whatever they already probably have some shame attached to anyway. Right? So just being there and being like, hey, I get it, I understand. This might be beneficial. Not you ought to do this, but have you ever considered, or here's some things that some people have found helpful, you know, to just be non-judgmental. And also, be prepared for people to push back a little bit. Just because you have a bright idea does not mean they want to hear it, right? Y'all falling asleep on me? Okay. Just because we have a great idea doesn't mean they're ready to receive that. It doesn't mean it's invaluable. It means give them some space and just be prepared. Maybe you come back again in a little bit. Maybe you come a different route, right? But just being prepared for that. And when you're prepared for it, it helps you not take it personal, right? If you say, if they would just quit eating all those donuts, they wouldn't be in the hospital right now. Well, remember, and there's a reason for whatever their behavior is. And you saying that probably isn't going to make them feel better or be more willing to listen to what you have to say, right? But maybe offering them some empathy and maybe collaborating with them and saying, you know, what do you think might be beneficial for you? What, is there anything I can do to help you, right? Sometimes they just want an encouraging word or some tools, but just kind of, if you open the door and let them do it. You can always refer out to, yes, sir.
I just wanted to comment on the thing you were talking about.
Yes.
I think there's a thing in our hospital culture, which is a statement like, due to the bad choices they've made, they're in this situation.
Mm-hmm.
And that's a legitimate statement, but I think if it's there by itself, it's not very helpful, like you're saying.
Mm-hmm.
It doesn't help the person. But to have something other than that, that's a good.
If a client's never seen that, that's like foreign territory for them. You know what I mean? So that's where that empathy comes in. I'm glad you brought that up. That's where that empathy comes in. Like, see it from their point of view, not just yours. Makes sense? If you don't know what their point of view is, sometimes people will tell you, if you ask them, not judgmentally. You know, you're not like, why you? But if you're like, hey, you know, how did you know what brought you to this point? Or how'd you get here? What's your story, man? That's not a judgment. That says, I'm actually interested in knowing. I don't mean any harm. I'm just curious, you know? I don't know and I don't want to make any assumptions. Can you help me understand? That opens the door for them to know that you care, for you to gather additional information and insight that will make whatever things you're able to offer them or to share with them more helpful, and then maybe less defensive to who are receiving it. Is that helpful? Okay. Be encouraging and there's plenty of us out there who would just love to see your clients. So, you know, when you know you have some short range stuff and you want to refer to a mental health provider that you know will meet their needs, then have a few of those accessible. So you can say, hey, I'll refer this out. Any thoughts on that? Any additional supports you guys can think of?
I've heard like dietitian or nutritionist kind of help them keep the full needs of if I, you know, that with a understanding of like how to do that.
Yeah, absolutely. Absolutely. Good stuff. I'll just briefly talk a little bit. These are just some therapeutic interventions available. EMDR, who is not familiar with that? Everybody's. Okay. EMDR is eye movement desensitization. You can read that. EMDR is a process, I like to explain it like this. When you are, everybody's been mad at something before, right? I like to say if you were on a scale from 0 to 10, but you were actually like a 15 about something that happened, you were like, ugh, and then you go to sleep, and you get good sleep, not a nap, but you actually hit that REM sleep, and you get up, and what was a 15 when you went to bed, it's now like a 2. You can look at whatever that event was, and it's not that bad. It doesn't really bother you anymore. The brain naturally processes things and kind of goes in and does a sweep through and cleans up some stuff, so it's not so traumatic for you. EMDR activates that for clients and allows them to swiftly go through different thoughts that they have of themselves and bring healing to those things. So it can have a really dynamic effect in that it allows their thought processes to change, their behaviors to change, their self-esteem. You know, it can target amazing areas and see very quick results. It's amazing. Love it. Dialectical behavioral therapy is, or DBT, is more of a behavioral therapy, and it kind of lets you look at both sides of the coin and just kind of bring some balance between like your emotions and your thoughts, and then find a happy medium and a new way of behaving. So it kind of brings you in tune to both sides and helps you adjust behaviors in that way. CBT kind of lets you go, where did this thought originate from? And now let me challenge it and let me work through all of these things and to get to a different type of behavior. And trauma focus is similar. That's more for kids, but it's similar, but it brings in that trauma. It has more focus on the trauma dynamic. There's a lot more, but any questions on any of those? Okay. Well, I appreciate your time and your interaction. Hope it was helpful.